Hello everybody. Today we will talk about chemotherapy. What are the chemotherapeutic treatment goals? 1. Palliative chemotherapy. 2. Chemotherapy for conversion to operability. 3. Adjuvant chemotherapy. 4. Neoadjuvant chemotherapy. And 5. Curative chemotherapy. What is adjuvant treatment? Adjuvant treatment is treatment given in addition to definitive treatment in an attempt to lower the risk of relapse. It is implicit within the concept of adjuvant treatment that there will be 3 categories of patients. Let's talk about these 3 categories. 1. Patients who have no residual disease after their initial treatment and for whom adjuvant treatment can confer no benefit. 2. Patients who have residual disease but whose disease is refractory to therapy and who are destined to recur in spite of adjuvant treatment. Even if they take this adjuvant treatment, this disease can reoccur. 3. Patients who have residual disease and whose disease will be eradicated by adjuvant treatment. What about neoadjuvant treatment? Neoadjuvant treatment is treatment given before any definitive local or loco-regional treatment. Example, treating large breast cancers with chemotherapy before surgery. Treating germ cell tumors within chemotherapy before any surgery to the retroperitoneal nodes. And pre-operative radiotherapy for rectal cancer. So neoadjuvant is before surgery, for example. There are several mechanisms by which this approach improves results. Neoadjuvant, how does it work or how can it be used? 1. It sterilizes malignant cells at the periphery of the tumor, which might make surgical margin less critical. 2. Shrinkage of the tumor might improve resectability or permit a less radical operation. Example, a wide local excision rather than mastectomy. One problem with neoadjuvant treatment is that by delaying the definitive treatment, such as surgery, because you are delaying it, it might facilitate the emergence of metastases containing resistant clones, the so-called the leaner and meaner problem. So it can lead to metastasis because you delay the definitive treatment such as surgery. What are the objective response in solid tumors? These can be a complete remission, a partial remission, an improvement, no change, and a progression. Let's talk about each one of these. What is a complete remission? It is a disappearance of all the tumor manifestations during the therapy. 2. Partial remission, which is tumor shrinkage more than 50% with no new tumor manifestations appearing during the therapy time. 3. Improvement. And what is this improvement? Is tumor shrinkage less than 50%. 4. No change. No change meaning that no change in size of the tumor during the therapy. And 5. Progression. A progression of tumor size or manifestation of new tumor sites during the therapy. What are the major classes of agents of chemotherapy? These include 1. Alkylating agents, 2. Anti-tumor antibiotics, 3. Plant derivatives, 4. Anti-metabolites, 5. Hormonal agonists and antagonists, and 6. A variety of miscellaneous agents.